People can get along without teeth or hair, but not without blood. Warm greetings to everybody who have assembled in this virtual gathering for the guest lecture on blood collection. Despite the fact that this topic dates back to 1940, when a blood collection program was initiated in United States, it is still relevant and evolving. As a healthcare professional, I hope that this topic will be inevitable for us throughout our careers. So, with this, now I would like to request Dr. B. Devi, Principal, Faculty of Allied Health Sciences, to deliver the welcome address.
Morning, all. On behalf of Faculty of Allied Health Sciences, I take this as an opportunity in welcoming you all for this webinar on the topic blood collection. I consider it as a great honor to welcome all the participants to take this important to express gratitude to our founder chancellor, Dr. E.G. Shanmugam sir, our honorable PhD, Arun Kumar sir, Secretary Shri A. Ravikumar sir, all our activities. Now, I think it's from the day, Dr. J. Lata, Department of Biochemistry, the topic of this webinar is blood collection. We all know that blood appropriate. I'm sure in this webinar we the knowledge of rules of blood.
Thank you so much, ma'am, for the kind greeting. Now, I would like to call Mrs. Stylen, lecturer, Department of Biochemistry, to introduce our guest speaker to the event, Dr. J. Lata, ma'am.
Good morning, everyone. It gives me immense pleasure to welcome the guest of honor, a thoughtful and an amicable person who has graciously accepted to give a talk on blood collection. Dr. J. Lata is an exemplar person for the code. One tree can start a forest, one candle can wipe out darkness, one hand can lift a soul with strong can make a difference in the world. Her education qualifications are illustrious, having completed her MBS and diploma in dermatology, venerology, and leprosy at Puncture Medical College, and later completed her MD at KVKP, Vishwanathan Government Medical College, Trichy. She is a trained physician, worked in various primary health centers and government hospitals since 2006. Currently, she is working as a senior assistant professor at KVKP, Vishwanathan Government Medical College, Trichy. She is a lifetime member of the Indian Association of Dermatologists, Venerologists, and Nephrologists. She is also a lifetime member of Association of Medical Biochemists of India. She has shined in the field for more than 16 years and also has enlightened the minds of multiple young people. It gives me a great privilege and an honor to welcome a doctor of each caliber. We welcome you, madam.
Thank you. Thank you so much for your kind introduction. Let us move on to the topic. Shall I?
So, ma'am, please.
screen visible?
Ma'am, we are able to see the screen.
Yes, please.
Yes, ma'am, now we are able to see the screen now.
Yes. One second. Is my screen visible?
Yes, ma'am, we are able to see the screen now.
Am I audible?
Yes, ma'am.
Yes. Let us proceed for the today's topic of discussion is blood collection. So the steps in the sample processing are, it starts from the physician who orders the test to the patients, and from the patient we are going to collect the blood samples. We need to identify the sample, process the sample, transport the sample from the point of collection, and then we have to process it. If needed, we have to store a part of it, and we have to do the analysis and report it, and finally the physician will interpret the result so as to treat the disease of the patients. So what are all the phases of analysis of the blood sample? So there are three phases of analysis. First one is the pre-analytical, next one is the analytical, and the next last one is the post-analytical phase. These are the three phases of sample processing or analysis. So what do you mean by pre-analytical phase? So the pre-analytical phase, it starts from the test ordered by the clinician, instruction to the patients, specimen collection, storage, transport, and processing of the sample. So the next phase comes the analytical processing, that is the testing of the sample per se. Then last phase is the post-analytical, that is the last phase. If required, the test should be retested and we are transmitting the results to the physician and interpretation and follow-up. So these are all the three phases of laboratory testing. So today we are going to concentrate mostly only on the pre-analytical phase, and that too only the blood collection part. Okay. So what are the prerequisites before the blood collections? So for blood collection, we need to know what the test has been ordered by the clinician. So the phases of pre-analytical are the test ordering by the clinician, instructions to the patients, type of blood sample, sample collection tubes, storage, transport, and processing. These treatment system. It is essential to accurately laboratory diagnosis a patient's care, and it also influences the laboratory efficiency. So what do you mean by test ordering by the clinician? Dear students, am I comfortable with English or you need to explain me in Tamil also? Please, any one of you answer?
Yes, ma'am.
Am I not audible here?
Ma'am, they are telling they're comfortable with English, ma'am.
Okay,
Because we
right.
have students from other states also.
Okay, right. So the test ordering by the clinician can be in the form of paper requisition, that is they write the tests which are needed for the diagnosis of the patient, or it can be ordered electronically as by computer based system, or in case of emergency, verbal order can also be taken for blood collection. But this verbal order has to be documented at a later stage after the emergency is over. So these are all the three types of ordering the test by the clinician: paper requisition, electronic ordering, or verbal. So what are the requisites the test requisition should contain? It should contain the patient ID, name of the patient, age of the patient, sex, whether it's an IP patient or the OP patient, with the number and ward of the patient, where the patient belongs to, which is the female surgical ward, medical ward, or like that. Then what are all the tests requested? For example, blood glucose or the thyroid test, likewise lipid profile. Then the time and date of sample collection has to be mentioned in the test requisition form. Source of sample, whether it is a blood sample, urine sample, fluid sample, and the type of sample, whether it is a fasting sample, random sample, or the non-fasting sample. Okay. Then it has to be mentioned. There has to be a mention about the provisional diagnosis. Then contact information of the requesting physician is must. Signature of the physician. Along, if it is urgent, it has to be mentioned or marked in red. Okay, these are all the prerequisites that has to be present in the sample request form of the test requisition. So this is an example of the I have displayed a test requisition form containing all the particulars like patient information, name, age, date of birth, medical record ID, sex, then contact number, date of sample collection. Then the next phrase contains the test order. You have to tick what are all the tests that are needed. Okay. Then along with the signature and contact number of the requesting physician. These are prerequisites in the sample request form. Then comes the instructions to the patient. So before collecting the blood sample from the patient, instruction has to be definitely given to the patient. Whether the patient has to come in the fasting state or the non-fasting state, all the instructions have to be given to the patients. Then coming to the specimen collection protocol. So there are, as I mentioned, there are different types of sample. The samples can be either blood, urine sample, fluid sample, CSF, pleural fluid, stool sample. There are different types of sample. Today we are going to see only about the blood collection. So what are all the collection requirements? We have to prepare the patient, we have to identify the patient, we have to know what type of sample is required, whether it is a whole blood, arterial blood, venous blood, and what type of containers needed to collect the sample, labeling requirements, and if there is any mention about the special handling precautions, like in case of arterial blood gas analysis, it will be transported immediately in the chill environment or in the ice cube or an ice pack. Then safety precautions. These are all the collection requirements. So what are all the types of blood samples? Types of blood samples may be whole blood, it may be serum, or it may be plasma. So what do you mean by serum and what do you mean by plasma? The serum is obtained when we collect the blood directly. So the liquid portion which settles after the blood is coagulated. That is the undiluted fluid portion of the blood which is collected without anticoagulant. We call it as the serum. Plasma is the fluid portion of the blood which is obtained after the addition of the anticoagulant. Okay. So the major difference between the serum and plasma, here the blood is coagulated. So the fluid part lacks the clotting factor in case of serum. Here in plasma, it comprises of the clotting factor because the blood is not coagulated due to the addition of the anticoagulant. Okay. So this is the basic difference between the plasma and serum. What are all the collection sites? Then we have to know. So we have seen about the types of blood sample, whole blood, serum or plasma. Then difference between serum and plasma. And then we have to know the collection sites. So collection sites. So from where do we collect the blood sample? Either from the vein or from the artery or from the capillary site. Or in case of emergency or seriously ill patient or in ICU patient or in a dialysis patient, we can even collect blood from the central venous catheter. So these are all the sites from which we can collect the blood sample. Of all these four, the commonest and the specimen of choice is the blood which is collected directly from the vein or the venous blood. Arterial blood We can do collect arterial blood from the arteries for estimation of the head gas analysis and for the estimation of the electrolytes. Okay. Capillary blood, it is obtained from by means of the skin puncture. It can be done in case of emergency testing of blood glucose, and for infants and pediatric age group, the skin puncture can be used. As I mentioned already, the central venous catheter blood samples in case of sick ICU patients. So venous blood. So what are all the veins from which we collect the blood, and what are all the approved sites for venous blood collection? So the preferred site are the antecubital area, that is the cubital fossa of the arm. So this one is the antecubital area of the arm. So we can collect the blood from the veins over here. So the next approved site is the back of the hand or the side of the wrist. Okay. So in the cubital fossa, what are all the veins from which we can collect the blood? In the order of preference, first one is the cephalic vein. So next one is the basilic vein, and next one is the median cubital vein. So we can collect either from the cephalic vein, median cubital vein, or the basilic vein. These are all the various sites from which we can collect the venous blood. So this is the pictorial representation. Here, this is the diagram showing so the red one is the artery and the blue one is the vein. So we can collect from either one of the veins. So what are all the special precautions we have to do while collecting the blood? First, we should not collect from the hand in which the IV fluid is running, and the blood should not be collected from the hand from the side of the mastectomy. This mastectomy is nothing but a surgical removal of the breast. So there will be edema, and we should avoid the hand from the side of the mastectomy, and limbs with indwelling artificial veins, artificial access devices, that is hemolysis port and all, we should not collect the blood from the limbs. Then prior to the collection, if there are no veins seen on the opposite side, we are going to use only the side in which the IV fluid is flowing. You should turn off the IV fluid, and you have to collect the sample after 5 minutes of stopping the IV line. And the collection should be below the IV fluids. Okay? So these are all the prerequisites. You should not collect on the side of the IV line and side of the mastectomy, limbs with indwelling artificial access device, and IV fluid should be turned off prior to collection. So this is the handheld near-infrared scanner, which is used to locate the veins in patients and blood donors for mapping them onto the skin. So this is an easy method. When you hold the infrared scanner, you will be able to visibly see the veins, so that instead of poking many times, you can easily collect the sample. So the next site for blood collection I mentioned is the artery. So the arterial blood, this is the gold standard sample for the analysis. Why do we prefer the venous blood more than the arterial blood sampling? So the arterial blood sampling is technically more difficult, and it's more painful too, and it requires stringent conditions for transport. In case of APJ analysis, we need to transport it immediately in the ice-chilled tray, and the sample should be processed immediately. So it's more hazardous for the patient because we are directly poking into the artery, and if there is any contamination, it may be hazardous for the patient also. So these are all these disadvantages: technically more difficult, more painful, strict conditions for transport and sample collection, and it is hazardous for the patient also. So from which artery do we collect the blood? The first choice is the radial artery, and the alternative sites, that is other arteries from which we can collect the arterial blood, of the brachial artery or the femoral artery. So how do we we know that we are entering into the artery or the vein, but we should palpate and see the pulsation. So after the pulse is formed, we are pretty sure that this is the artery, and from that we can take the sample. This is the pictorial representation. Here we are poking the artery and they are taking the sample. So what are all the complications of arterial blood sampling? Arteriospasm, that is constriction of the arteries. Next one is hematoma. Hematoma is nothing but a localized collection of blood or excessive bleeding from the arteries. As there are many nerves adjacent to this area, you can also injure the nerve. So nerve damage can occur, and fainting episodes or the vasovagal response if you directly prick the nerve. These are all the complications of the arterial blood sampling. So next one is the capillary blood. We can collect the capillary blood from by means of skin puncturing technique. So for whom we do this capillary blood collection, or what are all the conditions we do the capillary blood collection? First one, in case of neonates, because it will be very difficult to identify the veins and it will be very painful for the neonate too. So we prefer capillary puncture in case of neonates, and even for geriatric patients, the skin will be too thin and elastic, so it will be very difficult for getting a venous blood. We can prefer a capillary puncture. And in ICU patient, where also there is hypovolemia and there will be difficulty in accessing the vein for collection of the blood sample. So in case of repeated testing, as in case of diabetic patient, we need to estimate the blood sugar every 2 hourly instead of pricking the several veins and taking 2 ml of blood. This will be easy for glucometer testing. We can do this capillary blood puncture. And in a setting if we need very small volume of blood, we can do a capillary slit puncture. Okay, these are all the settings for which we can collect the capillary blood. So from where do we get the capillary blood? By skin puncture. So the sites for capillary blood collection are the palmar side of the tip of the third and fourth finger of the non-writing hand. Then infants, this is the third and fourth fingertip, the non-writing hand. Then for infant less than 1 year, the preferred sites are the lateral or the medial plantar surface of the foot. And sometimes earlobe can also be used for capillary blood collection. So these are all the sites from which we can collect the capillary blood. So the depth of the needle should be 2.5 millimeter only. You should wipe off the first drop of blood and then collect the sample for processing. So that's all about the capillary blood collection on the skin collection. So the differences between the capillary blood versus plasma in most cases are minimal. So you can pretty well do the capillary blood sample also. So the difference in case of blood glucose, okay, between the venous blood and the capillary blood is, it is the venous blood glucose is 7 milligram per deciliter less than the capillary blood glucose. So you have seen our grandparents or parents doing testing with the glucometer, that is by capillary blood puncture. So the difference in the blood glucose, if a test between the capillary blood and the venous blood, it will be around 7 milligram per deciliter in the venous blood. This is because of the tissue utilization. So what are all the advantages of this capillary blood puncture? So the advantages, it's very simple. So we need only very small volume of blood. It is relatively painless and there is no risk of scarring and there is no pain. Okay? So the last but not the least, the next type of blood collection is from the central venous catheter in case of ICU patients and PCU patients. So these are all the various sites from which we can collect the blood. Then coming to the phlebotomy steps. What do you mean by phlebotomy? Phlebotomy is nothing but the process of collection of blood. The process by which we collect the blood samples from the patient is called as phlebotomy. And the person who collects the blood sample, we call it as phlebotomist. in the phlebotomy. First, you have to make sure the identity of the patient, because if we have two patients by the name Kumar, you have collected the wrong sample from the wrong patient. So there must be at least 2 to 3 unique identifiers from each patient. You should verify the name, father's name, age, sex, either the ward number or the IP or OP number. Then you should assess the patient's disposition. You should check the requisition form. If you see the requisition form, you should see what are all the test orders. If it is a blood glucose or the serum fasting glucose, you should see the suitable ready puncture site. You should make the requisite equipment, that is, you have to prepare the spirit cord, then the needed vacutiners, syringe, disposable glove and all. Then you should prepare the patient and the puncture site. Then you should perform the venipuncture, collect the sample in the proper container, assess the possible complication, decide whether resampling is needed or not, and you have to label collection tubes at the, you have to keep all the label collection tubes at the bedside itself, and you have to send the specimen immediately to the lab with the requisition. These are all the steps in phlebotomy. So what do you mean by sample collection tubes? Having known where to draw the blood from either from the artery, vein, capillary or from the syringe. So you have decided on where you are going to collect the blood sample. Then into which tube will keep the blood sample which you have collected. Coming to the sample collection tubes. These are all the various sample collection tubes with different colors. Okay? What does this color mean? And what are all these tubes called as? So the tubes or the blood collection tube, we call it as a vacutainer. It is a sterile tube which is made up of either glass or plastic tube. The vacutainer is nothing but a blood collection tube which is made up of sterile glass or plastic. So the vacutainers have a closure that is evacuated to create a vacuum inside the tube. Thereby, it enables a predetermined amount of blood to be withdrawn into the tube. It has a color rubber stopper at one end, which is a kind of code for different types of sampling. So we'll see in the further slide what are all the different color codes of the vacutainer tubes. So the different color tubes contain some additives to preserve the specimen. So what are all the advantages of this vacutainer tubes over the cylinders? It is very safe to use. It's also easy to use. So the tubes come with the pre-added additives. So we need not worry about the quantity to which for 2 ml of blood or how much amount of anticoagulant is needed. So you need not worry about the amount of anticoagulant or the additives needed. Then the color coding of the stopper is universal. So it makes easy to understand and communicate to the lab personnel and the medical fraternity. And it allows many tubes to be filled at one sitting. And there is also low chance of hemolysis if you collect in the vacutainer tube. Since the stoppers need not to be removed for adding blood to the tubes, there are minimal risk of contamination. Okay? So these are all the advantages of the vacutainer tubes over syringes. So as I have shown in the picture, there are various different types of sample collection tubes of the vacutainers. The different types of sample collection tubes are the color coded tubes: yellow, blue, red, green, lavender, grey. There are also many other colors, but I am going to concentrate only upon these 6 types, as these are all the most common which are using daily. So what does this yellow tube means? This yellow tube, it is a vacutainer used for collecting the blood culture. So the content of this yellow tube is, it contains sodium polyanisole sulfonate. It is an anticoagulant, and it also contains the growth media for the microorganisms, since this is a culture tube. Okay? This is the yellow color tube. Then this blue color top, it is a sodium citrate is an anticoagulant. So when you collect the sample and centrifuge, we get the upper fluid portion, which is the plasma, which is, as we have added anticoagulant, the fluid portion which is getting upon centrifugation is the plasma. It contains the clotting factors. Okay. So after collecting the blood, here is a mark given in the tube. This is the mark. The tube must be filled up to the mark given. Okay. After collecting the blood into this tube, you have to invert the tube so as for effective mixing of the blood sample with the pre-added anticoagulant. So there is specific times which we have to invert each tube. For this sodium citrate tube, the gentle inversion for 7 to 8 times, so as to ensure the appropriate mix. Prothrombin time, INR, activated partial thromboplastin time, for testing the D dimer, for fibrinogen testing, and for coagulation factor assays. We collect the blood in this sodium citrate tube. These are all the uses where we use the sodium citrate tube or the tube which contains sodium citrate. Okay. Then this is a common red top tubes. We call it as a clot activator tube. After collecting, it contains a clot activator so as to enhance the clot activation, so we can process the sample easier and do the analysis at a faster rate. We have to gently invert the tube 5 times after collection to mix the clot activator with the blood and allow the blood to clot upright for 30 minutes. So you should not disturb the tube after blood collection. You have to invert it for 5 times and keep it aside for effective coagulation. Effective coagulation or clot formation is needed because if there is no clot formation, there will be hemolysis. Then hemolysis will lead to disturbances in the analysis. So upon centrifugation, the upper fluid portion we get is the serum, because it's a clot activated tube. All clotting factors will be utilized for the formation of the clot. So we get the serum with the clotting factors. Okay. So the size, the blood quantity, there will be a mark in this tube also. So this is the black mark. The size of the tube will be around 4 ml. The uses of this red top tubes are for determination in chemistry testing and for the diagnostic testing of the serum for all infectious diseases. We use this red top tubes. Wherever you need serum, we can use these tubes. The next tube is the lavender color tube. This contains an EDTA. EDTA is also an anticoagulant, ethylene diamine tetraacetic acid. This tube produces plasma upon collection and centrifugation. For optimal specimen quality, you have to gently invert the tube 6 times after blood collection. The size of the tube is 4 ml. So what are all the tests which can be done by collecting the blood sample in this EDTA tube? We can do complete blood count, eosinophil count, erythrocyte sedimentation rate, hematocrit, the reticulocyte count, and for sickle cell screening. All these tests can be done by collecting the sample in this EDTA tube. So you have to, while collecting the sample in the pre-additive containers, you have to be very careful about the volume of the blood which we are collecting. So there will be a minimal fill volume and a maximum fill volume. So the blood volume which is collected will be within this 2:1, whether it should be a minimum fill or a maximum fill. What happens if there is underfilling? If there is less volume of blood collected than the appropriate required amount, that is up till the marking, the concentration or the ratio between the blood and the EDTA will be altered. So there will be more EDTA which lead to cell shrinkage and degenerative changes. So the hematocrit value will be decreased and the MCHC, the parameters which use in the complete blood counting, will also be altered by means of less volume of collection at the EDTA. vacuotinus. So there will be swelling of the platelet and disintegration of the platelet, and leukoagglutination also occurs. So it is essential that we collect the blood in the required amount. The next tube is the gray tube. It contains a sodium fluoride. This is an anti-glycolytic agent as well as anticoagulant. So it produces plasma sample. So the tube inversion ensures proper mixing of the additive and the blood. For optimal specimen quality, you have to invert the tube 5 times after collection for the mixing of the anticoagulant with the blood. This, as it contains sodium fluoride, which is an anti-glycolytic agent, the sample collected in this tube can be utilized for diabetic screening like GTT and glucose estimation. So these are all the various color-coded tubes we have seen. One is the yellow tube or the culture tube, blood culture collection tube. Next one is the red top, blue tube, which is a citrate anticoagulant tube. Then lavender EDTA tube, and the grey one, which contains a sodium chloride. So what do you mean by inversion? This is one inversion. You have to just turn it upside down and then keep it straight. This is one inversion. Like this, we have to do like 5 times for the red tubes, and for all other tubes, you have to invert it gently 7 to 8 times. So I told you already. Now the Vatican tubes comes with the minimum fill indicator and the maximum fill indicator. So this is the minimum fill indicator and this is the maximum fill indicator. So as to ensure the appropriate ratio of the blood and the added additives. So having known about the different color codes of the vacuotinus, how will you draw the blood? Can we draw the blood into different types of tubes haphazardly? No, we should not do. There is a definitive order of draw. So what is the purpose of this order of draw? So to avoid the possible test result error due to cross-contamination from the tube additives. Since the different containers contain different additives, there may be cross-contamination because of this tube additives, which lead to lab test errors. So to prevent this, there is a predefined order of draw. Only by this order of draw, we have to collect the blood samples. This method of this order of draw to be followed for both vacuomed tubes as well as the syringe transfer of the blood. So what is the order of draw? So what is the steps which we have to follow while collecting the blood? First, we have to collect blood in the yellow tube. Since this is a blood culture tube, there has to be no contamination. So first yellow tube we have to collect. Second one is the citrate tube, which is a blue color tube. Third one is the red top clot activated tube. Next one is the heparin. So I do not mention about the heparin tubes. It's a green color top. Then next one is the EDTA lavender top. Last one is the glycolytic inhibitor or the grey top. This is the order of draw. Yellow, blue, red, green, lavender, and last one is the grey. That order: blood culture, sodium citrate, clot activated tube, heparin tube, DDTA tube, and last one is the glycolytic inhibitor or the sodium fluoride. So this is a summary about the color coded vacuotinus. Light blue, here the content is sodium citrate. The amount of inversion needed after blood collection is 8 times. All these tubes need 7 to 8 times gentle inversion except for the red tube, which needs only 3 to 5 times inversion. So the red tube is the serum separator or the clot activated tube. Green tube is the heparin, the content is heparin. Lavender color, the content is EDTA. Grey color, glycolytic inhibitor, fluoride, sodium fluoride. Yellow color is the for the culture tube. Okay, this is the number of inversions needed after blood collection. And coming to how to knowing the site from where proceed to collecting the blood specimen. So what are all the things needed for the collecting the blood specimen? First you have to read the test order, read and interpret the test order. If the physician has written the test required in the form, he will just put a tick or he have write for lipid profile. Okay, so you have to read and interpret the test order. By reading the lipid profile, you are interpreting that what are all the tests that has to be done in lipid profile, like total cholesterol, HDL, LDL, triglycerides, and you will presume the quantity of the blood needed for doing all these tests, and which site we are going to, whether we are going to take the venous blood or the arterial blood sample or the non-fasting sample. That one is the interpreting the test order. Then we have to assemble the equipments needed for the collection of the blood. Then we have to treat and identify the patient. Then you have to prepare the patient. Then we are going to collect the blood sample. So what are all the? So first we have read and interpreted the test order. Then we are going to assemble the equipments and supplies. So what are all the equipments and supplies which are needed for blood collection? We need disposable syringes or vaticanus with syringes, tourniquet, disinfectant like alcohol or spirit, cotton, disposable gloves, plasters for sealing the puncture site. Then we need a marker pen for labeling. In case of computer generated systems, we need a barcode scanner. Okay. So these are all the equipment and supplies which are needed for the blood collection. We have to place it all ready, and then we have to go for the blood collection. So venipuncture procedure. So before going to venipuncture, so now we are going to deal about the drawing of the blood from the vein. So we call it as venipuncture procedure. So the phlebotomist must have the skill and knowledge regarding how to draw the blood from the vein. So the next one is the first we have to identify the patient by means of two forms of identification, like name, age, sex, ward number, or the IP or OP number. Then you have to check the requisition form for the requested test and other patient information, and any other special draw requirements, like whether it is a fasting sample or a timed sample. If the physician has requested GTT or the glucose tolerance test, we have to collect the blood in a timed manner, like half an hour, 1 hour, 1.5 hours, 2 hours. So you have to check the special draw requirements. You have to gather all the equipments, tubes and supplies that you need to draw the blood sample. You have to treat the patient and position the patient in the chair. Blood collection should not be done in a standing position. So the patient should be seated comfortably in the chair, or he should be lying on a bed. Then you have to wash your head and select the suitable site for venipuncture. If you are going to draw the blood from the vein in the cubital fossa, you place the tourniquet 3 to 4 inches above the selected puncture site. The tourniquet should not be tied too tightly, or it should not be left on the patient hand for more than 1 minute. Then you have to put on the non-lactose glove and you should palpate the vein. Then after selecting the vein, you have to cleanse the area. Cleansing the area with either spirit or alcohol. Then you should allow the area to dry because if you draw the sample before the drying of the alcohol, there are more chances for hemolysis. Then you have to grasp the patient's arm firmly using your thumb and then draw the skin taut, and you should anchor the vein. Then you should insert the needle through the skin into the lumen of the vein. Okay, the bevel head should be facing upwards. The needle should form a 15 to 30 degree angle from the arm surface. You should not probe the vein. Okay. Then, after knowing or that you have entered into the vein, you have to remove the tourniquet. Because if you draw the blood. While placing the tourniquet, there are more chances for hemolysis. Then you have to remove the needle from the, after collecting the required quantity of blood, then you have to remove the needle from the patient's arm using a swift backward motion. You have to immediately place a cotton over the puncture site, hold it with pressure for at least 1 minute so as to stop the bleeding. If you do not do this step, there will be a formation of hematoma, that is the localized collection of blood, or there will be excessive bleeding from the puncture site. So you have to make sure you should not be in a hurry. After collecting the blood, you have to seal the puncture site and hold it with pressure for 1 minute. Then you have to dispose of the contaminated materials. Okay, these are all the steps you should follow. So this is the pictorial representation of what I have said in the various steps. First, this picture shows the vein. You are identifying the vein. Then 3 to 4 inches above the vein, you are tying a tourniquet. Then the needle you are inserting in the middle of the targeted vein at an angle of only 10 to 30, not maximum of 30 degrees. Okay. Then once you are sure that you have entered inside the vein, you have to remove the tourniquet. If this one you are entering into the vein, you have to remove the tourniquet. Then you have to collect the blood into the syringe. Then after collecting, you have to seal the puncture site. This is the procedure by which we are collecting the blood from the vein. The same procedure applied for the arterial site also. While doing arterial blood sampling, we have to ascertain whether we are in the artery by palpating. If you find the pulse, then you are entering into the artery. Okay. So what if there is no vein visible, or if there is no prominence of the vein? What are all the measures by which we can improve the prominence of vein? So if we incline the arm in the downward position, the veins will be prominently seen. Then if we stroke the vein in the distal direction also, the veins will be prominently seen. And by asking the patient to clenching the fist, we can make the vein prominent. And by gentle tapping of the vein and warming the area by means of the heat circulating pad also. And one more method, the newer infrared scanners allows us for the visible inspection of the vein. It will be easier method for drawing the blood from the veins. So these are all the measures by which we can improve the prominence of vein. Then after collecting the sample, we are letting the blood into the specified container, whether we need the serum or the plasma, into the color tubes. Then we have to place a label over the sample collection tubes. So it can either be handwritten labels or the pre-printed barcode labels. So what are all the information that has to be needed in the label? The label should contain the patient name, unique ID, the clinical specimen, whether it is a blood sample or urine sample, then what are all the tests which are ordered, time and date of collection, along with the collector's initial or the phlebotomist initial. These are all the information which are needed in the label. Okay, so these are all the, having known how to collect the blood. Okay, what are all the types of blood sample, what are all the sites from which we collect the blood, how do we collect, what are all the different type of collection tools. So coming to laboratory errors. What do you mean by laboratory errors, and what are all the phases where the laboratory errors can occur? The errors can occur in either in the pre-analytical phase, analytical phase, or in the post-analytical phase. Why do we have to give more importance to this blood collection? Because most of the laboratory errors occurs in the pre-analytical phase, which contributes about 60%. In the analytical phase, it's about 10%, and the post-analytical, that is in the reporting phase, transcriptional errors accounts for about 30%. So much. So because most of the errors occurs in the pre-analytical phase, we are giving much importance to this blood collection. So what are all the common errors which occur during there will be errors in the sampling. Then mislabeling of the specimen. Instead of placing the label for method, you are placing the label over hair root. Then there will be wrong lab results, short draws or wrong anticoagulants to blood ratio. I mentioned about the underfilling or overfilling of the pre-edited tubes. Then mixing problem. If we are not properly inverting, making the blood and the anticoagulant to mix, there will be clot formation or hemolysis will be there. Wrong tubes and wrong anticoagulants. If you need a serum sample and you are drawing the blood and placing it in the PGTA tube, you will not get the serum sample. Okay. Hemolysis or lipemic sample, chemoconcentrated sample, exposure to light at extreme temperature, processing errors, and incomplete centrifugation or improper storage. These are all the errors which accounts for more than 60% which occurs in the pre-analytical phase of the sample collection. So coming to the most common pre-analytical error, which is hemolysis. So what do you mean by hemolysis? It is the hemo means blood and lysis means rupture or destruction of the cells. So rupture of the RBCs. This is the most important cause of specimen rejection as well as pre-analytical error. So what are all the causes for hemolysis? Too small needle, pulling the plunger too fast, expelling the blood vigorously, shaking of the tube vigorously, or mixing the tube vigorously, performing the blood collection before the alcohol dries from the sample collection area. These are all the various causes for hemolysis. So this is the pictorial representation. Excessive plunger pressure, vigorous mixing, large size bore of the needle, prolonged constriction or over application of the tube, milking of the capillaries, all these lead to hemolysis. So what happens if there is hemolyzed sample for processing? So what are all the effects of hemolysis? It leads to changes in most of the parameters. The most common being increase in the potassium level and increased growth hormone time, increased phosphorus, increased troponin, magnesium, T4, ammonia. And there will be decreased RBC level, decreased APTP, decreased fibrinogen. All these parameters will be changed. These are all the effects of hemolysis. So why do we need to concentrate of the lab errors? So what happened if we report wrongly to the patient? So if we give a wrong report to the patient, the physician will try to provide the proper treatment and it will lead to additional or unnecessary investigation. So if we are in a diabetic patient, if you are giving a wrong blood report instead of normal level of, for that patient, if the blood glucose is 220, you are giving us in 80. So the physician failed to give insulin and lead to improper treatment to the patient. So if you give a abnormal creatinine level to a normal patient, which lead to the physician thinks in terms of any renal damage and it leads to additional testing or unnecessary investigation. And if you give a wrong report, if you give a abnormal blood glucose level for a normal patient, it will lead to unnecessary treatment, like the physician will write anti-hypoglycemic drugs and or the insulin to the patient, which lead to complication for that patient. And it also lead to, if you give a wrong report, it also lead to delay in the correct diagnosis and provision of inappropriate patient care. So these are all the consequences of lab error. So we have to be very particular to decrease the lab error, that to maintain the pre-analytical phase, which accounts for more than 60%. Okay, that's why only we are dealing with all these things, like what are the site, what are the precautions, how to collect, where to collect, when to collect, and all. Okay. So how do we minimize the pre-analytical errors? By continuous training like this. We are training new people to how to collect, where to collect, when to collect, what to collect. Okay. Continuous training and evaluation performance of the paramedical staff. Coordination and communication between the clinical and the laboratory presence. Checkpoint monitoring at the sample reception desk and workstation. So these are all the parameters or criteria by which we We can reject the samples which contains insufficient patient information. Hemolyzed sample, inappropriate collection container, as I mentioned already, wrong tube collection. Clotted or hemolyzed sample in a EDTA tube. Hemolyzed sample in a red tube. Prolonged sample transport time. That is, you are collecting the sample for a fasting glucose at around 6 a.m. and you are transporting it to the lab by 12 a.m. 12 noon. So the results will be inappropriate. So we can reject the sample. If there is insufficient sample for processing, also we can reject. These are all the criteria for rejecting the sample. Overfull tubes, underfull tubes, as there will be inappropriate ratio between the blood and the additives. Fluid contamination, contaminated samples with bottom threads, leaky container, duplicate samples. These are all the various samples where we can reject the samples. Okay. Then, last but not the least, I would like to mention a few words about the universal precautions. You should handle all these samples as if they are infectious. So assume that all human blood is potentially infectious for HIV, hepatitis and all infectious diseases. So you have to adopt the universal work precautions by using gloves, eye protection, lab coats. You should always use sterile, single-use, disposable supplies for sample collection so as to avoid cross-contamination. So biosafety lies at 3 levels. 1, you have to protect the patient by means of using single-use equipment, disposable. You have to disinfect and work in a clean, dedicated area. Second one, you have to protect yourself by wearing the personal protective equipment, so the PPE, like gloves, gown, mask, and face shield. Then, protecting the environment, you have to dispose the supplies and equipments which we have used for blood collection into the biomedical waste color coded bins. Okay, after disinfecting. Short summary about the blood collection. First we dealt about the various phases of laboratory analysis, pre-analytical, analytical and post-analytical. Today we dealt only about the pre-analytical phase, where the sample collection or the blood collection. We have seen the different types of sample, either it is whole blood, plasma or serum. What's the difference between plasma and what is the serum? Plasma, if you collect the blood sample with anticoagulant, we get the plasma, and without anticoagulant, we get the serum. And what are all the various sites of blood collection, like artery, blood, capillary site, that is by means of skin puncture, and other site is the central venous catheter. Then what is the advantages and disadvantages of the arterial blood sampling and the venous blood sampling, and what are all the special situation in which we can take the capillary blood collection for infants, geriatric patients, ICU patients, in which case we need repeated testing, we can do the capillary site. And in case of sick ICU patient, we can collect the blood sample from the central venous catheter also. Then coming to the venous blood supply, what are all the venous blood collection, what are all the sites, what are all the veins, most common veins we are choosing. That is the basilic vein, cephalic vein and the cubital vein. And you can either take it from the dorsum of the hand also. In arteries, radial artery, brachial artery and the femoral artery. These are all the sites of blood collection. Coming to the sample collection tubes, we have seen about the various color coded tubes. That is the yellow, which is used for blood culture. Then the PDTA tubes, that is the lavender tubes, sodium citrated anticoagulant tubes, blue color, red top or the clot activated tube, which we commonly use for biochemical analysis. On centrifugation of the clot activated tube, we get the serum. Then grey color, which is the glycolytic inhibitor, sodium fluoride, and apparent tube, which is green color. We studied about the order of draw. What are all the order by which we can draw the blood. Then about how to do a veni puncture, and what are all the common sampling errors, and what is hemolysis and what are all the effects of hemolysis, and report upon the biomedical waste, that is universal work precautions. Thank you. If you have any doubts, you can ask me.
Ma'am, that was indeed a fascinating and informative speech from you. I request the participants, if you have any doubts, to post it in the chat box. Participants, if you have any doubts, you can post it in the chat box.
Dear students, if you have any doubt, you can please ask me. Was it useful? All the students left out.
Yes, ma'am, very useful. Thank you.
Thank you.
Students, if you have any doubts, you can post it in the chat box. Thank you, ma'am. Now I would like to call upon Dr. G. Bhavani, Vice Principal, Faculty of Allied Health Sciences, to deliver the vote of thanks.
Good morning, ma'am. Thank you. First of all, I just thank our honorable management committee chief guest, friends, seniors, and everyone present here. And it's my privilege to propose a vote of thanks on this webinar. And it's time to acknowledge everyone at this juncture. On behalf of Faculty of Allied Health Sciences, once again I extend my sincere thanks to all my team for making today's event a real success. And with these blessings and grace, we are able to make this event successful. And it's my gratitude and pleasure to thank our Honorable Chairman, Dr. A.C. Shanmugam Sir, Resident Engineer, ACS Arun Kumar Sir, Honorable Thiru A. Ravikumar Sir, Vice Chancellor, Dhanalakshmi Madam, for their support, support and encouragement. And I also extend my heartfelt gratitude to our Director, Faculty of Allied Health Sciences, Dr. Lavender Madam, Principal, Dr. B.L. Nandini Madam, for their motivation and assistance in guiding us throughout this webinar. And now I would like to thank our dear chief guest, Professor J. Lata, Assistant Professor, and Department of Biochemistry from Trichy Medical College. Thank you, ma'am. Thank you so much. Actually, you gave a broad explanation about the blood collection. It was wonderful. And I hope most of the students, they might have benefited out of that. It was a clear explanation. That's why they don't come across with any doubts over here. Thank you so much, ma'am. Special and sincere thanks to all the faculty members and students for their participation in this webinar. Once again, I thank you. Thank you, ma'am. Thank you so much.
I request the participants to fill the feedback form posted in the chat box. We did like to thank everyone who helped this event a success once